at the same time. Maybe you can clarify. I hope I'm not wrong on that. That's from what I know, but just clarify.
Governor, you're exactly correct. We, in the case of what Senator has asked about the gumboots and raincoats, we did a procurement in November 2023 as Nairobi County Government, and we were able to supply 1,200 of them with these commodities in response to the cholera epidemic, which we were able to control as Nairobi County. That was running then. We are able to give commodities, and particularly those around WASH, and these are commodities around the WASH response, to the CHPs whenever we have any outbreaks, and we do this with support from the county government budget as well as development partners. When it comes to the CHP kits, we receive this from the national government. We have accounted for that, and we have a distribution list of how these kits went to the CHPs.
Thank you very much.
And so,
let me help you so that in future you frame your answers correctly. You know, we are not asking for very complicated answers in the Senate. Why don't you just come to the Senate and say, you have asked about this, give us details and say, we have supplied 1,200 CHPs on this particular area, in this particular period, with the following commodities. Okay? There is no competition here. This is just feedback from the CHPs who are saying, we want to work for Nairobi County better. Some of these places are not accessible, we need gumboots. This, you know, just direct answers. You know, if you say under WASH program is a complete another different program. We cannot wait until there's an outbreak of cholera for us to supply them with gumboots. It's raining every day in Nairobi, you know. So what we are saying, I've had your answer, but please, you know, I can tell you, Governor, you know the problem with some of the answers we are given, and sometimes we sign them off. It starts with perception. You know, these questions are being asked because I'm being fought, you know, those things. Please, Daktari, you have good answers, but you see, you have not collected your data well. Just provide data and evidence. It solves our work. In short, one look at your budget, one look at your procurements. You know you are Nairobi very well. We know the season we are in the country. Where they need to be facilitated with gumboot, facilitate, and we agree with you. Not all places require those commodities, so give those who deserve so they can give you a better service. Can you go to question number 2?
Chair, just before you go to question number 2, you know, there is an attitude from the Nairobi County government that they can be clever with words and they think we will not know what they are saying. Because what she is saying is they went out to buy gumboots after or during a cholera outbreak. You have a full complement of 7,400 CHPs, Governor. 7,400. You know their job description. You have sent them out into the estates to do this work. There are certain basic things that from the beginning you would think that they would require. That's the whole point. If even for you during the campaigns when you sit with these CHPs, the question of gumboots has always been there. From 2017 to 2022, you talk to the same people that I talk to. So the expectation is, if you can tell us of the 7,400, 4,000 don't need them because they work in I don't know which area of this is Nairobi that you think that they will not need gumboots, because when Nairobi floods, it's all over the place.
No, they're not on the...
That's what I'm saying. So you will tell us of the 7,400, we have provided 4,000 gumboots for the people who work in these specific areas because of the sort of hygiene issues that are there. If somebody asks for a raincoat, Governor, which ones will you give raincoats and which ones do you think even if they are rained on, it's okay?
Chair, it's such a simple issue. We shouldn't split hairs.
No, it's not a simple issue. The reason why we are splitting issues is because you've decided to split issues. The response that is coming from her, she decided to tell us that they bought 1,700. She needs to tell us for whom, as the chair has framed. So can we have a conversation? Are these things that the county government thinks are necessary for these CHPs to be able to do their job? And if they are, then we say only 3,000 of them need it. These ones don't need it. And if you can be able to give us that breakdown of what has been done. So unless there is another cholera outbreak, can the remaining 6,000 or so...
I think you have made your point, Senator Sifuna.
Gumboots.
Let me just allow some small clarification, then we go to the question number 2.
Chair, we'll give all of them.
That's enough.
If there's someone who has actually you answered, the issue of even giving CHPs in Kenya a stipend was brought by me in this house. I believe in the work of CHPs. And we were the first county to give them a stipend. And our stipend is the highest.
Now you
so if something can
yeah.
give them, just allow me to answer. If something can make them work better, I'll be the first person to do it. We shall provide additional. What we said was the essential, the basic essential that's a national standard has been provided. We shall do more. I think it's a fair case, you know, and we shall do it.
Very good. Now let's go to question number 2.
Number 2 was the measures being taken to address technological support gap. Chair, long and short of this is that we have 7820 CHPs. The provision by, you know, these devices are being provided from the national support. They provided for fewer than they are. So there's been a push as COG because it's throughout the counties, it's not just in Nairobi, because you want standardized equipment. And so that procurement is being done at the national level. I think the support from one of the organizations, is it CIF or who is it? One of the...
Yes, it's CIF, yes.
Child Investment Foundation Fund are the ones that procured that for the national government. So they will bridge that gap for all CHPs across the country, including Nairobi. The next question.
So maybe, Governor,
yeah.
So how many were provided for Nairobi? Because then it makes it possible for us to make a follow-up with the ministry.
Yes, thank
because
you.
it's their work.
So 7,502 were provided with that, with the devices. The gap, therefore, is the difference with 7820. That's the difference that we. So it's been tabulated for each county how many need to be done. We will be very happy if the Senate can assist and we can provide the list from COG for all the counties, because it's also not neat and clean and fair for them. You're working, one CHP has this device, another one doesn't have the device. Remember, the national government also got over 100,000 CHPs. There are more than 100,000 CHPs in Kenya. So that is why the gap is there.
Yeah, Chair, the question also covers the qualitative aspect of the devices themselves that have been provided. The conversations with the CHPs that it is old technology. Most of the time it's unreliable, it's failing. So maybe you can address that as well in terms of the quality of the technology itself to be able to do actual online reporting. Because when we were with them, the demonstrations there, those phones hang 90% of the time, Governor. And it makes their work very, very difficult. So maybe you can address that as well. Instead of buying the machine for chapatis, maybe we should buy iPhones for the CHPs.
Senator Sifuna, you are out of order.
Sorry, I didn't hear.
That is a completely different program that doesn't even fall within the mandate of this committee.
What it is?
If he has anything to ask about school feeding, he should go to the Committee of Education.
No, it just shows that it is lunchtime. Something, anyway. Chair, you know this ICHIS program is national. The ones providing the software, the devices, some say even the bundles. And Chair, we have been insisting as COG and as counties, just leave that entire thing to counties to do, because we can provide software, we can then look at the quality of, you know, it should be left to us. I'm glad I've seen what you passed recently, that you've put the entire now stipend from the national government as a conditional grant to come to the counties. Because even to the next question, there's no delay of stipends from the county government. We never delay, not even once. There's no month that they have not been paid. But the national component sometimes can take 2-3 months and then it comes in lump sum. But the county one has never gone beyond a month. You know, sometimes it might be late in the month. Because I said it very clearly that no CHP, or rather that I, as a governor, will not be paid before CHP as a stipend. We're on the same payroll. So I am paid on the same day, the CECs, the directors, and the CHPs. We're all paid on one payroll on the same exact day. So, again, it's something the committee can take up.
But I think that is okay. Now that we have put as conditional grant, it will all come. So payment.
But see, that's just the money. Now the software, the management, the scoring.
What we need to do now so that we can help you. I think now ask your chair of that COG to give us a report.
Oh, good.
So that we are now able to follow up. In fact, 2 things. So that we are able to help address the issue of CHP. Let us get the data on the number of CHP without the kits, so that we can follow up with the ministry to exactly provide. Then do the challenges they're having in terms of technology and so forth, so that we can follow with them up to upgrade. And your proposal as a COG in terms of it being left to you, so that we can still pursue the same trend of making that provision of resource a conditional grant so that it can now be managed from counties. You know, that's why there is need for collaboration between COG and us. But you know, your chair hardly comes to any meeting called by the Senate, so you have to come to Senator Sifuna so that we make progress.
Governor, there is a question that I was asked to specifically put to you by those CHPs. They understand that the component that delays is from the national government component, right? And county governments, I think including yours, whenever the disbursement of equitable share delays, you have found ways to make sure that you pay your people. That's a fact. Why are they not included in the similar program so that you are able to pay them the full one, covering even the bit by the national government, and then when the money comes, you're able to deal the same way you deal with salaries when there is exchequer delays?
We can look at it for the government component when it delays. The only issue that I foresee we would have is COB approving that difference, but it's not a big amount. It's something we can explore, definitely. Yeah, so that we can cover for national when the money comes. But now that it's a conditional grant, again, you know, the exchequer delays really hold counties back, you know. But covering for the national government 2.5, if COB allows, we can be doing it. And then when the money comes, we now take it back to our CRF for other purposes.
But I think that's a very good idea. That now you can explore that. Now the last question there.
These are things that we should even just be discussing because it's such a good idea.
Don't make me make some progress.
This is why we want you to be coming to the
struggle to avoid.
more often.
Sifuna has just said it, so let's go on.
It's a good
The last
idea.
question.
Chair,
Senator Sifuna.
you know these conversations cannot happen anywhere else, Governor. This is why we insist that you come here.
It's good.
We exchange ideas.
Thank you.
Chair, I wanted to say the same thing. I think Governor, being Senator Emeritus, I told him the other time he needs to use us, you know, I mean the health committee or whichever committee. He's been here before and he knows about, I mean, where we can support, where not. So I don't know why he's not taking advantage of us.
I think that's why he's here today. Now let's make
Can I also
progress.
come on my own motion? Suomoto.
Yeah, you can invite as a committee. What's wrong in African engagement?
Yeah, because
You know, Nairobi carries 7 million people. It's a very significant population of this country. Almost actually 10% of the population of the nation. So the health of this city is extremely important. So can we have a response to question number 5?
Chair, on question number 5. No, there was number 4. On why CHPs have been required to conduct SHA registrations for the public without adequate facilitation. That's an issue they have raised. It's an issue I've also raised similarly at COG. I feel that, you see, the 2.5 that comes from national shouldn't just be an assumption that then they take on any other additional task. Because, Chair, taking care of 100 households for one person is actually a task. And this network of CHPs is so critical because they know this house has this issue of diabetes, this other house has this. So there should have been some facilitation.
But Governor, I agree there should be some facilitation. But how about if we ask the CHPs, just in the 100 households they are taken care of, ensure the 100 households are registered in SHA. That's also as they go about their work, in terms of checking on these other things, they also make those inquiries. But I don't, of course, we are not saying they don't deserve additional thing, but I mean, it also enhances the healthcare, provision.
You know, Chair, this, things improve with time. When I came to this house, we had 15 billion. We left it at now 18. My senator has pushed it to 20. Chair, CHPs were getting nothing. I brought a motion. We started as Nairobi. Now they're getting something 3.5. Ideally, CHPs should be at minimum wage, if you ask me, because they're no longer volunteers. They're actually workers. They actually do meaningful work. If it was up to me, we would have a conditional allocation to all counties for CHPs to be at a minimum wage, because of the work they do. Then you can give them different tasks. The same way, my staff here, yes, they have their JD, but I can give them different tasks alongside health because they have a full salary. So that would be our proposal, Chair, moving forward, that CHPs actually moved to minimum wage. The next question is efforts to enhance training for CHPs on use of electronic community health information systems to ensure efficient reporting and awarding of marks. Chair, we have the CHPs report to CHAS, Community Health Assistance. We have employed additional, we've promoted actually some of the CHPs who've shown leadership. They've shown ability to manage teams and to train others. So those ones have been promoted to actually be employed as community health assistants. These ones are now as county employees. They're trained on the system, and so they serve as the supervisors. They're providing mentorship, coaching, training on niches to CHPs on a day-to-day basis. Chair, in one of the mental health trainings that we had with the CHPs, and I tell you, I really love the CHPs. One of them said that their stress goes down because I'm in their WhatsApp group, and when they raise issues, I can see. Such things actually help us, because mental health is big for them to be, at a good mental space, and that is what Dr. Gunu told me that. I hope it is true. Yeah, but I'm on the WhatsApp group with them, and that's what they said, and yeah, so I think that brings us to the end of that question.
Thank you very much. Now we have two statements that are related. A statement by Senator Amida Kibwana and Senator by Thabeda. All are dealing with Mama Lucy. And they are not, because Governor, we want to try and dispense with this so that new statements can find their way into the House. Can we have responses? And I think these can be handled together. There are more of similar questions. We can have just a comprehensive response of the two questions by Senator Amida. The question by Senator Mutinda is on state the total number of women detained in the hospital facility due to inability to settle maternity fees, stating the respective amounts owed, state the payment modalities or options in place set by the hospital management for defaulters, explain the protocols followed by the hospital management in the event a patient is unable to raise maternity fees. The one for Senator Mida is asking for a report on the extent of overcrowding and strain at the Mama Lucy Kibaki, outline measures taken by the county government of Nairobi to address overcrowding, and then clarify the steps being taken by patients are not unfairly charged for services they are unable to access due to current constraint. Recommend measures on how the national government and the Ministry of Health can support the county government of Nairobi to improve. I think those, since we have written responses, you can give us just a whole summary of you and just allow senators to ask if there's a specific question they want to deal with.
Thank you, Chair. And Chair, I agree. Now that we'll exhaust all of this, and I want to commend your clerk, Humphrey. He has found a way to be able to communicate better with our county, such that we don't have the backlog that we had before. And so whatever comes to this committee, Mr. Ringera, who was my campus mate, will be able to make sure we dispense with very quickly, Chair. Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process